Hey there, we're back. And so this is the mental health disorder, eating disorders. These are some of the points and content that I consider to be important. It's brief and succinct on eating disorders, and it covers most of what I've seen on nursing exams and quizzes, HEI exams and quizzes, the standardized testing, Lippincott, standardized testing that I've seen. These are the topics for eating disorders. Okay, so let's get started. Before I go into eating disorders, I want to talk about a little bit about the history of the way women in particular were viewed or considered way back when. This is the Renaissance period. This is the 14th to the 16th century. Women of this era were basically homemakers and took care of the children. It was what's called a patriarchal society where the men were in the authority roles. So this particular body style was considered someone with a larger body style. Back then was considered someone with more money, because there was a time in those days when people didn't have money to buy meat, especially. So if you were able to or had the money to buy food, it was considered desirable. So women of this size were considered more desirable in the 14th to the 16th century. Now let's go back later into time. This is in the 1960s. This is a model. She's still alive. She is now 77 years old, and her real name is Dame Leslie Lawson. Her stage name or professional name was Twiggy, and she got that name because she was pretty much considered the size of a twig. She was an English model, actress, singer, very popular back in those days in the 60s and 70s. And so you can see the difference between the Renaissance and the 1960s. A huge difference. She was considered desirable in those times. During those times, her measurements were 31, 22, 32. So her bust was 31, her waist was 22, and her hips were 32. And she weighed 91 pounds, and that was considered desirable. So you can see the differences in the public eye. Back then in the 60s, there was not social media like there is now, but it's still very prominent in social media, the way women particularly are viewed and looked at. And that can greatly affect the way a woman looks at themselves. Okay, so let's get into eating disorders. This is just a general information about the brain, the part of the brain that controls appetite. Again, in our society and culture, a lot of societies and cultures and holidays are centered around food. Think about Christmas, Thanksgiving. And so someone who is struggling with that really has a tough time when it comes to holidays. If they're already struggling with eating disorder. There are notes to the side in the notes in these PowerPoints, so if you can download those, I'm not sure if I can tell you how to do that, but if you can download the PowerPoints from my videos, you would also be able to see the notes that I have in there. Okay, so here has historically society and our culture have influenced what is considered desirable for females. Okay, and so we're going to get right into the first major eating disorder. There are three of them. Three. Anorexia, bulimia, and binge eating disorder. There's three that I will talk about. Okay, the first one, anorexia. This is what the signs and symptoms are, and then I'll get into what you're going to see, how your patient will present. Okay, this is a person who is afraid of gaining afraid of gaining weight. They're obsessed with gaining weight. They're obsessed with their appearance. Nursing diagnosis. I know a lot of NCLEX questions don't use nursing diagnosis anymore because they have been found not to be covered as much on the NCLEX. But I'm just going to mention it. Nursing diagnosis for someone with anorexia would be disturbed body image, low self-esteem, or altered body image, something like that. This person feels like they are fat, even though they may be grossly underweight. They are purposely not eating, starving themselves. Because when they look in the mirror, they see something totally different from what you and I may see. And I've seen some really good videos where that I've used in the past with Lippincott has some good videos with actors, but they're very realistic. With the anorexia nervosa, okay, these are the symptoms: distorted body image, preoccupied, and refusing to eat. So when we had patients in the substance abuse mental health units that I worked in as a nurse for over 10 years, if we had a patient coming to the nurse's station with a history of eating disorder, and they need to be weighed, which is one of the likely doctor's orders. The doctor may order daily weights. We would have the patient step on the scale, but we would have them turn around so they can't see what their weight is, because if they see that, they may obsess over that. Okay, one of the most important assessments in an early assessment of someone with eating disorders is to identify the client's nutritional status. Okay, that was a test question that I saw. This is the people that are most at risk for eating disorders are ballet dancers. They're at a 7 times a higher risk of anorexia. And sports in general, especially like, for example, a sport like wrestling, where the person needs to get in a certain weight class, and they may binge and purge, they may starve or fast for a period of time in order to get into the weight class that they want to be in. The problem is that these habits may continue even after they stop engaging in the sports. And it's a behavior habit that may continue. So one of the goals for treatment would be for the person to have an increase in self-esteem, because this is a self-esteem issue where they see something different in the mirror and their self-esteem is not within normal levels. So they're going to have an increase in self-esteem. They're going to be able to verbalize positive aspects of themselves, exhibit less preoccupation with their own appearance, and have a more realistic body image. So these are some of the ways that your patient will present with anorexia in particular. Okay, other symptoms are hypothermia, they're always going to be cold, bradycardia, low heart rate, hypotension, low blood pressure, edema, swelling, possibly in the lower extremities. Lanugo is a fine baby-like hair, and metabolic changes, okay, with the stomach and the digestive system. They may also have anxiety and depression are very common. So medications commonly treated for eating disorders is usually an antidepressant. Okay, weight loss is excessive. With the hypothermia, there can be a significant dangerous drop in the body temperature. There can be bone fractures, poor circulation, amenorrhea, which is the absence of menstruation. The woman menstrual cycle will stop. They may have cold intolerance, dizziness, chest pain, abdominal bloating, discomfort, constipation, weakness, low concentration, poor memory. They may, again, like I mentioned, they may be obsessed with food. They may hoard or hide food. They may prepare food for others, but they don't eat the food. There may also be compulsive behaviors like hand washing that go along with this diagnosis. It's usually in adolescence, teens, where it develops. And again, anxiety and depression may come along with this. Hyperactivity. This is a person who may excessively exercise so they don't gain weight. Okay, next is bulimia nervosa. Okay, so you must know the differences in the anorexia and bulimia. So with anorexia, there is starvation. Okay, bulimia, they are eating, but they're also purging. So they're putting their fingers usually down their throat to cause themselves to vomit. They don't want to absorb the calories that they've just binged on. So it's a compulsion. The causing yourself to vomit is a compulsion, and the binging on lots of food, many calories, and then purging, causing themselves to throw up. They can also use diuretics, enemas, in order to get rid of those calories that they've ingested. The excessive vomiting, or there may be a lot of use of diuretics or laxatives. It may cause dehydration and definitely an electrolyte imbalance. Also, if the person is purging by causing themselves to vomit, the gastric acids in the stomach coming up through the mouth are going to cause tooth erosion. So that's a sign that you may see tooth erosion. And if you have your patient is using the fingers in the mouth, in the back of the throat, to cause themselves to vomit, you may see calluses on the dorsal part of the hand. Okay, and that's called Russell's sign. This is called Russell's sign. This is not as reliable, because the person may actually teach themselves how to vomit without using the hand. but this may also be a sign and symptom that you may see. The difference between the two, and I'll talk about these as I go along, the difference between anorexia and bulimia. Anorexia is going to be a low BMI, low body weight. Okay, low body weight, sometimes to the point where they need to be hospitalized. With bulimia, they're eating and vomiting, but they are absorbing some calories. So most people with bulimia have more of a normal weight range. Maybe slightly underweight, some slightly overweight, but their BMI is going to be more in the normal range. And don't forget, BMI range, 18 to 24, okay? Okay, so that's bulimia. Okay, they may be bulimia. They may also be exercising excessively. Here it has, and I have in bold the most important things. Most clients with bulimia are within normal weight range, normal BMI. Depression, anxiety, substance use are common. Okay, so they are self-induced vomiting in order to get rid of those excess calories that they've ingested. Also, over obsessed with their appearance. Okay, and here's the last eating disorder, binge eating disorder. This is a person who eats and eats and eats, but doesn't purge. So you can imagine what's going to happen. The person is going to be obese. It's going to lead to a huge weight gain. They're not purging, so they are ingesting all of the calories, but they're not getting rid of the calories. Okay, leads to obesity. Still obsessed with food. It's usually emotional eating. And so therapy, they need to go into therapy. All of these eating disorders, a person should start in therapy so that they can work on their self-esteem, the anxiety, depression, and these the people with binge eating disorder are at a high risk of gaining excessive amounts of weight. Low self-esteem and boredom can be triggers. Eating is out of control. A lot of times this will get to the point where the person is bedridden, not even able to get out of bed. So how are they getting the food? Well, there's usually an enabler, a family member or friend who's bringing the food to them. Okay, so really in this case, the whole family should be in therapy to address these issues. Okay, and here's where I talk about BMI. I don't think you have to know how to calculate it, but this is how BMI is calculated. Normal range, I said 18 to 24. Okay, 20 to 24, somewhere in that range. I don't think test questions are going to be that obscure. They're not going to be they're not going to be that close in range so that it's hard to figure out what the correct answer is. Obesity is 30, BMI 30 or greater. Anorexia is generally BMI 17 or lower. 15 is the extreme. That would require hospitalization. The stomach acids coming up with, I'll go back to bulimia, where the person is purging and binging and purging. The stomach acids coming up the esophagus can also burn the esophagus, and there can be bleeding, and to the point where that can really be a high-risk situation. Behavior modification is therapy where they're going to work at goals for their treatment. The therapist may ask them, what goals would you want to establish? Where would you like to see yourself? Where would you like to change your behavior? And the patient usually has a lot of input. It's their care plan, so they should have input on their goals and their whether or not they've reached those goals. One thing I will say about family therapy is that the therapist, social worker, whoever it is, should be careful about blaming the family for like anorexia. If there was an obsessive obsession with food growing for the child growing up, if the family feels like they are being blamed for the disorder, it's going to be really hard to get them involved in treatment. Okay, so the healthcare professional should be careful about that. So there is a behavior modification with therapy. Staff and the client together will talk about their goals, and they may have a system of rewards. The person may be in an outpatient treatment center, or they may be inpatient. There are inpatient treatment centers for eating disorder, where they would be in individual therapy or group therapy. Okay, there are no medications that are going to directly help the client. The main treatment for eating disorder is to treat the anxiety and depression. So, for example, there may be antidepressants used for treatment, and that's the example I give you here is an selective serotonin reuptake inhibitor. That's fluoxetine, brand name Prozac, very common antidepressant. What's funny is there may be eating disorders in a family member, but not all family members are suffering from eating disorders. So it's not necessarily genetic. Okay, nursing care. Okay, I kind of follow the nursing process when I'm talking about these topics. So in the centers I've worked at, if we had a patient with eating disorders, the doctor may order what's called a meal op or meal observation. So that is where a nurse or a tech is going to sit with the patient during meal times, especially if they are bulimic. Just to keep an eye on them, to monitor how much they're eating, and to try and keep them from going to the bathroom right after they eat to purge. Okay, we can only encourage the person, and so we're just going to document at that point. So someone would sit with the patient during meal times and support them and watch how much they're ingesting, usually 30 minutes. And the patient should be observed for at least 1 hour after meals, so that they are not stashing food or discarding food. They may even need to be accompanied into the bathroom. Well, that's according to facility policy. We did have a patient at the center I worked at, was the nurse went into the patient's shower, in the room into the shower. This was an inpatient treatment center. And she discovered the patient was purging in the shower. Okay, and that's it for eating disorders. I try to keep it brief. And I will post this on my YouTube, and check it out also on TikTok. I'm sharing my videos on TikTok now, and Pinterest, Instagram. It's Nursing with Hart, PhD, HART. And I hope to see you there. Take care and have a great day.